As a doctor, my training was all centered around the hospital. But then if you're going to work in the outside world, if you're going to work in primary care or family medicine, or if you're going to especially work in functional medicine, you're looking at chronic diseases, and almost all of those are, if not all of them, are lifestyle driven.
One of the things that I find really interesting is that you're hiring health coaches to work with you.
Absolutely.
So at what point did you decide that bringing health coaches into a functional medicine practice was important or valuable, and how did you come to that decision?
So in functional medicine, we do a lot of lifestyle change, and a lot of the interventions that I'm doing are diet and lifestyle and taking supplements. And it's one thing for me to create this super fancy plan that I hand to somebody and say, now I'll do this and change your life. But really that takes time, and you need support, and you need accountability, and you need motivation. And for that, you really need a partner. And so in my view, functional medicine works when coaching is a part of it.
How does that partnership between, the doctor and what you're figuring out that they need to do and passing that off to the health coach, and what that relationship is like?
Yeah. So we totally work as a team. We use the same electronic records, so everybody can see everybody's notes, everybody can see what's going on, everybody can see lab tests if they're labs. And usually somebody starts out with me, and after we meet and have a first visit and sometimes do some testing, I create a plan. And then within a week of initially meeting with me, every single person who's a member of my practice, because we have members at our practice, they meet with a health coach within a week. And that intake visit is really to learn about what are the challenges going to be for that person to achieve some of these goals? Is it realistic for them to be gluten-free? Is it realistic for them to cook more? If we're talking about getting them to exercise more, what are the barriers to that? And how can a coach help them troubleshoot all of those so that they can get where they need to go? Sometimes it's emotional stuff, and having that support of somebody there is really important. So from there, I really empower the coaches I work with to take it where it needs to go and to work with that person. So everyone has a different, unique plan that they work with a coach. We kind of tag team back and forth, and so far it's really working really well.
That's fantastic. Yeah. What do you think the role of health coaches are within the healthcare model?
Well, I think when we talk about outpatient care, it's a very different thing than inpatient care. So hospitalized patients, as a doctor, my training was all centered around the hospital. But then if you're going to work in the outside world, if you're going to work in primary care or family medicine, or if you're going to especially work in functional medicine, you're looking at chronic diseases, and almost all of those are, if not all of them, are lifestyle driven. So if we're moving towards a world where everything is based on outcomes, and if my patients and my members and the people I'm working with achieve outcomes, the reality is they're not going to achieve those outcomes just by taking a drug or just because I tell them what to do. It has to be about their journey and empowering the patient. And so as we move towards this team-based vision of medical care that I think we're really moving towards, it can't just be about the doctor. I think this team-based approach is really where healthcare is going at large, and so I think coaches are really going to fit into that picture much more than they have in the past.
I love that idea of a health team and having all those people in your corner to support you.
Yeah.
I think that's really valuable. Well, it's just such a pleasure to have you here and to have you speaking with our students and to be a part of our community and everything that you're doing in terms of embracing health coaches and building a part of that team partnership. I think is just so valuable and helpful. So,
well, thank you. We're really, everything that we're doing at Parsley Health, we're trying to be innovative in every way. And by making health coaching part of the medicine, that's one of the important innovations that we have there. And so I'm really excited about it, and so excited to work with IIN coaches. Both of my health coaches are IIN grads, so thank you guys.
Thank you. Yeah.